Hi everyone, Dr. Brian Stanner here at Woken Spinal Care in Mount Pleasant, PA. This week we're going to talk about something that probably every patient has probably heard at one point in their life. That's sciatica. We're going to talk about the sciatic nerve, what it is, what it does, and how you can get sciatica. So what I'm going to do this week, we're going to actually show the sciatic nerve itself. My camera person, she needs to zoom in a little bit. That's perfectly fine. You don't need to look at me as much. You guys look at me every single week. So this is the sciatic nerve right here. It starts in the lumbar region here, a little under the lumbar region, and it runs all the way down right toward about the knee. And then it branches off in the smaller nerves here in the back of the leg, the tibial nerve, and then a couple more nerves down that way. They're called, in here it says the common peroneal. I call it the common fibular. It just depends on what age group of chiropractic you're in. So this is the sciatic nerve here, and that's what causes sciatica. So what is sciatica? It's when the sciatic nerve is inflamed, and it's a very, very common, probably 90% of people on this entire planet will experience a sciatica episode at some point in their life, whether it's very acute or more of a chronic situation. So what are the different types of sciatica? There's two different things with sciatic nerve, or with the sciatic condition. There's one that is called piriformis syndrome, and there's one that is called wallop neuralgia. Now, are they actually sciatica? No, but can you tell the difference? Honestly, no. It's the same symptoms. So in piriformis syndrome, the piriformis muscle, it's not in the drawing here, but the piriformis muscle sits just like this, kind of how I'm crossing diagonally, just like that. You're sitting on that nerve. So that muscle, or you're sitting on that muscle. So when that muscle tightens up, what happens is it just begins to stretch and stretch and stretch, which will then press more pressure on that nerve. That's piriformis syndrome. Same symptoms though, it runs down the leg all the way, vice versa. The other one is wallop neuralgia. Now, wallop neuralgia, I don't need to use this to explain. Wallop neuralgia is when most people do it. I do not, but I don't have it in here right now. You put your wallet in your back pocket and you're sitting on it. After a while, it puts pressure on that, causes that sciatica problem. So those are just two different really common things that people try to distinguish between wallop neuralgia, piriformis syndrome, sciatica. All have the same symptoms. What are the symptoms of sciatica? Well, the sciatic nerve does two different things. Again, it is the largest nerve in the entire body. It has muscle function and it has sensation function. So whenever somebody is experiencing sciatica and they experience it for long periods of time, what happens is you begin to have weakness in the back of the leg, you start to have bladder issues, bowel problem issues, sexual dysfunction, all those different things, because look where it's all at. And if we can actually look here, it's controlling all these organs in the lower body here. Again, largest nerve branches off into more nerves. They all go to one place or another. So those are different things. Another thing, numbness and tingling. Most common thing with sciatica, it shoots right down the leg, all the way down, numbness in the feet and toes. So that is the classic sign of sciatica. Now, how does sciatica happen? So many different causes and things that we've already talked about in previous blogs. Degenerative disc disease, disc injuries, the wallop neuralgia, piriformis syndrome, just a factor of life, with degeneration, everything like that, muscles, everything weakening, it all happens that way. Trauma, infections, all these different, there's so many endless possibilities of how sciatica is caused. But here's the good thing, it can be treated. How is it treated? It just depends on the patient. Someone who has an acute condition that's maybe been going on for a week or two, even a couple of months, just needs some chiropractic care. Someone who has a more severe case, like a disc bulge, a disc herniation, anything like that, yeah, they might need our decompression therapy. And it just depends on how long. It could have been something that happened a couple weeks ago and it was a confirmed disc bulge, or something that some patients been having problems with for 5-10 years. Another thing is people think, can it be like, can neuropathy help with that? Yeah, it can. Our neuropathy program, yeah, it can help because it's a nerve, and after a while, if you have it long enough, the nerve can die. So our neuropathy program that we talked about last week can help regenerate that nerve. So there's endless possibilities here that can help you get better with sciatica problems. Now, if anyone is experiencing sciatica, which I'm sure, again, most people that are listening to this blog right now probably at one point or another have had it, give us a call. If you know anyone who has it, have them give us a call. We can help them with it, whether it's a more mild condition or a more severe condition. So that's all I have for you guys this week. If you have any questions, don't be afraid to reach out to me. And otherwise, enjoy our rainy day, and we'll see you in next week's video.